Assessment of aortic stenosis severity and management. Echocardiogram findings. A. The Simpson method is used to assess LV function by ejection fraction. B. PLAX view is used to assess the morphology, degree of calcification, and opening movement. C. PSAX short axis further assesses morphology and the number of cusps. D. CW Doppler measures peak velocity, mean gradient, and the aortic velocity time integral, VTI. E. Pulsed wave Doppler is used to measure prestenotic velocity and the VTI in the LV outflow tract, LVOT. F. LVOT diameter in zoom mode is used to calculate LVOT area. Aortic valve area is calculated by continuity equation and dimensionless index is calculated by LVOT VTI/AVVTI. Aortic valve area indexed, AVA/PSA. Stroke volume index, SV/PSA, ml/m2. Severe aortic stenosis. Aortic Vmax greater than or equal to 4 m/sec or mean delta P greater than or equal to 40 mmHg. Aortic valve area typically is less than or equal to 1 cm2, or AVAI less than or equal to 0.6 cm2/m2. Very severe aortic stenosis is an aortic Vmax greater than or equal to 5 m/sec, or mean delta P greater than or equal to 60 mm/Hg. Severe aortic stenosis can be asymptomatic or symptomatic. Asymptomatic severe aortic stenosis is of two types. C1. Asymptomatic severe aortic stenosis with normal ejection fraction. C2. Asymptomatic severe aortic stenosis with LV systolic dysfunction, ejection fraction less than 50%. Symptomatic severe aortic stenosis is of three types. D1. Symptomatic severe high gradient aortic stenosis. D2. Symptomatic severe low flow, low gradient aortic stenosis with reduced LVEF, LVEF. D3. Symptomatic severe low gradient aortic stenosis with normal LVEF or paradoxical low flow severe aortic stenosis. Aortic valve area of. Indications for aortic valve replacement in patients with aortic stenosis. AVR indications in symptomatic patients, 3 indications. 1. Adults with severe high gradient aortic stenosis, stage D1, and symptoms of exertional dyspnea, HF, angina, syncope, or presyncope by history or on exercise testing, level 1. 2. Patients with low flow, low gradient severe aortic stenosis with reduced LVEF, stage D2, level 1. 3. Patients with low flow, low gradient severe aortic stenosis with normal LVEF, stage D3, AVR is recommended if aortic stenosis is the most likely cause of symptoms, level 1. AVR indications in asymptomatic patients, 7 for severe and 1 for moderate. 1. Patients with severe aortic stenosis and an LVEF less than 50%, stage C2, level 1. 2. Patients with severe aortic stenosis, stage C1, who are undergoing cardiac surgery for other indications, level 1. 3. Patients with severe aortic stenosis, stage C1, and low surgical risk, AVR is reasonable when an exercise test demonstrates decreased exercise tolerance, normalized for age and sex, or a fall in systolic blood pressure of greater than or equal to 10 mmHg from baseline to peak exercise. Level 2A. 4. Patients with very severe aortic stenosis, defined as an aortic velocity of greater than or equal to 5 m/s, and low surgical risk, level 2A. 5. Patients with severe aortic stenosis, stage C1, and low surgical risk, AVR is reasonable when the serum B-type natriuretic peptide, BNP, level is greater than 3 times normal, level 2A. 6. Patients with high gradient severe aortic stenosis, stage C1, and low surgical risk. AVR is reasonable when serial testing shows an increase in aortic velocity greater than or equal to 0.3 m/s per year, level 2A. 7. Patients with severe high gradient aortic stenosis, stage C1, and a progressive decrease in LVEF on at least 3 serial imaging studies to 60%, level 2B. 8 moderate aortic stenosis, stage B, who are undergoing cardiac surgery for other indications, level 2B.